Hi, my name is Sarah Griffin. I'm the owner and founder of Edge Clinical Nutrition, and today I'm going to give you my favorite clinical rotation tips 40 things to master before you start your dietetic internship, specifically tailored to the modern day intern, and then my best pro tips to make you a standout intern. You can download the resource for free in the comments. So I have my dietitian license. I have a master's degree in nutrition with an emphasis in nutrition education, and I have my CNSC. I've actually taken the CNSC exam twice. I also have a certificate in nutrition, specifically enteral and parenteral nutrition from Aspen and the American Society of Healthcare Pharmacists. It's a pharmacy level certificate that I did in 2024. And I'm a graduate of the Duke Clinical Nutrition Fellowship and online course. So I have a lot of education, a lot of experience. I specifically practicing in critical care, typically in the ICU environment, but I also have a lot of experience with oncology and GI patients. I am a preceptor. I still precept to this day, and it's one of my favorite things. I love teaching. I taught college nutrition for 5 years, and I love precepting. So my goal with this checklist was to develop a resource for the modern day intern. I looked for resources in 2025 and beyond for clinical dietitians, dietetic interns preparing for their clinical rotation. There's not a lot of resources out there, you guys. And a lot of the resources that are out there are actually really outdated. So, first of all, dietetic interns are required to have a master's degree, which really just changes the caliber and sets the bar a bit higher for those interns coming in. So there's different expectations of those with a master's degree. There's a different caliber of work that's expected, and the CRDNs for the nutrition dietetics professional have changed quite a bit in the last 10 years. And so I'm going to give you tips for today's dietitian, what you actually need to know to prepare for your clinical rotation and really impress your preceptors and have a really good shot at landing a job after your internship is over. So clinical is notoriously the hardest rotation. I think without any qualification, typically interns feel like this is the hardest. They're typically the most nervous about it. And I think that's for a couple of reasons. The expectations of the clinical rotation are really varying and wide. And so for your food service or your community rotation, you might be expected to do things that are like more within your scope. Whereas with clinical, it's sort of like anybody's guess in terms of what your preceptor is going to expect from you. It really depends on what your site, the acuity of your site. So if you're placed in a small community hospital or a level 1 trauma center or something like that, you can have vastly different experiences. So I'm going to try to talk to just kind of the middle of the road intern who is practicing at some level of acuity, and then not so much in a community hospital, because at some point you'll be doing a rotation, probably with higher acuity. So this is for any intern really at any type of location. Obviously, if you know that you're going into a pediatric facility, if you know you're going to do trauma, those would be some specific areas to brush up on. But in general, for the average clinical rotation, if you will, my checklist kind of talks about that and what you need to do to prepare. And preceptors have wildly different expectations of interns. So one of the first things you can do is email your preceptor and ask what they want you to know walking in. But there's a lot of this that's really on the intern as well. And so you want to have really good preparedness and kind of want to know your stuff when you walk in the door. So here's some of the things that I really think that you should drill down before your internship. I always tell my interns to do this. And if you have all of these things, have a good handle on pretty much all of these things on the checklist, you'll be a really impressive intern. So the first is vocabulary. This can be tricky until you actually get into the hospital and start charting and reading medical notes. If you haven't done that before, it can be kind of tricky to know what type of vocabulary you might be expected to know. But I would just generally get comfortable with medical abbreviations and charting shorthand. Also, any type of abbreviation that doctors might use in their notes, so that you don't have to look those up as you're reading through medical notes. I actually provide extensive lists of vocabulary in my nutrition support skills course. And there is information down below in the comments section in the description of this video, and you can access that course, which is a really great place to start to prepare yourself before going into your clinical rotation. So if you don't want to bother looking all of that up, you can purchase my course and get instant access to all of that. In terms of the nutrition care process, definitely being really well equipped to write PES statements is going to be important. So certainly in your other rotations, If you're rotating in WIC, for example, or outpatient clinical spaces, you will have experience with PES statements, but definitely pull out your old notes from undergrad or from your master's and go over PES statements to feel really confident with those. It's important to review common diagnoses, and here's a tip. A lot of interns, and I did this when I was an intern as well, a lot of interns will try to come up with a really unique diagnosis or something different and outside the box. The reality is that in clinical, we reuse the same diagnoses over and over and over. I know that sounds very boring, but it's true. So you'll typically recycle the same diagnoses over and over. Inadequate energy intake, inadequate oral intake, increased nutrient needs, and altered nutrition-related laboratory values. And typically we always say, if you can come up with a diagnosis that is related to intake, use that first. So if you're deciding between altered nutrition-related labs and inadequate energy intake, we typically would always choose intake as the first PES statement, mostly because we can have the most effect on that. We have lesser effect on a patient's labs, but we could potentially affect their intake more. So those are sort of like the four main ones. You can write those down in your notes. And these are on the checklist as well, but those are really helpful just to put on a sticky note, and you'll really end up using those same four over and over and over and over. In terms of labs, it's really important to be familiar with reference ranges for common labs and what do labs mean. So this might be one of the most overwhelming parts, thinking of starting your clinical rotation, because we don't get a lot of instruction in our undergrad or even in our master's degree about labs. What do they mean? Which labs are most tied to nutrition? What does a high and low look like? Which medications can cause highs and lows? That can be really tricky. This might not be something that you have notes from undergrad or even from your master's on. So if you do have notes about this, definitely pull those out and review those. I have an extensive 4-page laboratory guide, a quick reference guide, if you will, in my nutrition support skills course, which shows you all of the most pertinent labs to nutrition, what they mean, and sort of clusters them together. So there's like renal labs and liver labs and GI labs. Those are really, really important. I think most interns come in with essentially no knowledge on labs, and so there's a really big learning curve here. But if you have even a basic understanding of labs, it'll really help you become really kind of a standout intern and really impress your preceptors. Medications, of course, are also going to be pretty complicated, but this is really important. So you do not have to be an expert in medications, really depending on which area your preceptor is working in. Perhaps you're in GI, and then you're in oncology, and then you're in the ICU. There's different clusters or different groups of medications that you use in each space. So you'll always be adding to your medications list. I would definitely plan to review a lot of common medications before starting your rotation, but then know that this is going to be a growth area. Really, labs and medications are two of the big growth areas here. So don't assume that you need to know everything on day one, and never stop learning. So always, always, always have a list of labs and a list of medications in your notebook, and just constantly add to them, because there's an almost unlimited amount of medications that you could potentially know. So here's some really important ones to focus on before you head into your clinical rotation. Be aware of blood thinners specifically, the main types of blood thinners, GI meds, so bowel regimen, constipation, diarrhea meds, nausea medications, things like that. Blood pressure medications that many, many patients are on. Diabetes medications, so insulin, GLP-1s, things like that. Appetite stimulants, some basic oncology medications. Of course, there's an almost endless amount of oncology medications, but some of the more common ones would be good to know. And then vasopressors, and definitely review pressors right before you go into your ICU rotation. So I do have a really great resource on diabetes in my nutrition support skills course. It lays out all the most common diabetes medications, pills, and injectables, and then types of insulin, their peak onset time, their duration. It's a really helpful quick reference guide. And then I have a great resource about medications as well. And then a special resource just on vasopressors, which really kind of breaks it down and tells you exactly how much pressor your patient could be on and safely feed the gut, and how much is too much. Nutrition calculations is another important part to be really well versed in. So you want to be able to calculate BMI. Ideal body weight as well is something that we use for our obese patients. And also being able to calculate if your patient has a BKA or an AKA or is paraplegic. There's different adjustments that we make to energy calculations for those folks. Tube feeding calculations are going to be really important, so you should be able to calculate a tube feeding calculation. I would say most preceptors don't expect you to be able to write a TPN on day one. That's something that typically they will teach. If they do a lot of TPNs, they'll teach you that process. They would want you to be generally aware of TPN, but not to be able to write one right out the gate. There's an expectation that the preceptor would do a lot of teaching there. But in terms of tube feeding, most preceptors really expect the student to be able to do tube feeding calculations on day one. And it takes a lot of time to teach those. So that's definitely something that you should learn before you go into your rotation so that you can at least write a basic tube feeding calculation. Maybe you're not writing a home bolus calculation for a patient with a fluid restriction and renal failure or something really complicated, but you should be able to do a basic standard tube feeding calculation. If you don't know how to do that, you definitely want to get my nutrition support skills course because I have a tube feeding calculation cheat sheet, which will walk you through calculations and make sure that you can do them exactly the same time after time. I also have 4 enteral nutrition calculation worksheets. And so you can go through those. I have a huge lecture about enteral nutrition calculations, which teaches you the ins and outs of tube feeding math. And then I have 4 worksheets, and then there's actually a video answer key to the worksheet. So instead of just throwing answers at you, I really walk you through in a video lecture and teach you kind of the art as well as the science of tube feeding calculations. And same with parenteral nutrition. I actually have a 12-page TPN calculation cheat sheet that will teach you how to do TPN calculations for PPN, peripheral parenteral nutrition, and CPN, which is kind of our new term now, central parenteral nutrition, and a 1-page worksheet so you can calculate your PN orders correctly every single time. In the course, there's also 4 parenteral nutrition calculation worksheets, and then I walk you through the video answer key as well. So that's really, really valuable. This is also going to be really important if you don't get exposure to PN or much exposure to PN in your clinical rotation. You still have to be competent in this. And it can be tricky if you're at a smaller hospital or a hospital that doesn't have a large census where the dietitians perhaps aren't writing many TPNs per day. You definitely want to get my course so that you can learn how to write parenteral nutrition calculations, and you can learn that separately on your own so that you can be prepared for the dietitian exam. Refeeding syndrome is something that comes up again and again, especially with our malnourished patients and our ICU patients. You want to be very well aware of adult, and if you do work with pediatric patients in your rotation, the pediatric refeeding syndrome guidelines, which are slightly different. You want to be aware of risk, refeeding syndrome risk, what that looks like, what screening looks like, initiation and advancement of nutrition support, which has actually changed in the last few years. So how many calories to start at, how much protein to start at, how much dextrose to start at, and how to increase over time. And then, of course, pertinent labs, how to monitor refeeding syndrome labs, and what electrolyte and micronutrient dosing looks like for refeeding syndrome. And if you don't know where to find that information, I have a really cool quick reference guide in my nutrition support skills course that will show you exactly all of these things: risk, screening, how to initiate, how to advance, what electrolytes look like, how much thiamine to provide, etc. Common conditions and nutrient needs for each. This is something that you will develop and learn over time, but it's really cumbersome to be charting and get to the middle part of your note where you're entering energy and protein calculations for your patient and have to pull out your huge textbook and filter through and be like, how much for a cirrhosis patient? How many calories for a heart failure patient? How many calories for a patient in their 3rd trimester of pregnancy with twins? You wouldn't have to want to look that up every single time because it takes a lot of time and will make your charting process very laborious. So it's really important to have a good reference for this. I've compiled all of the major disease states into one great resource. So it walks you through energy, protein, and fluid needs for the adult patient, for all of the major disease states that you'll see in your rotation, and then for pediatrics as well. So be really familiar with things like kidney disease, diabetes, heart disease, IBD, oncology, critical care, liver disease, wounds, and burns, and how much energy and protein and fluid those patients might need. Be also very aware of predictive equations. So Mifflin, Penn State, those types of equations, we want to be aware of when to use them and in what populations to use them in. Some other last minute things here that I would really recommend you review before your clinical rotation starts: common IV fluids, so different types of hydration like D5, which is a 5% dextrose, normal saline, half normal saline, those types of things. Common therapeutic diets: what does a bariatric diet look like, a renal diet, a diabetic diet, a gestational diabetic diet, carbohydrate limits for these per meal. What does a heart healthy diet look like? It's important to be aware of charting, so review your ADIME. You can probably pull out your notes from your undergrad and review that. We also want to work on charting objectively. So this is something that you'll learn and get much more proficient with in your clinical rotation. But you always want to chart objectively, meaning you're not putting your personal opinion into the charting note. And if you haven't written a chart note before, that can actually be pretty tricky. So that's something that you will often work with your preceptor on, but just getting familiar with what does a chart note look like? How do I chart objectively and scientifically? How do I talk about a patient scenario in an objective way without adding too much of my own opinion? Medical terminology and vocabulary. You want to review your patient interviewing skills, so motivational interviewing, how to ask open-ended questions. One of the easiest things to prepare this is just to grab a friend or family member and just do a nutrition interview with them. I really recommend doing this before you start your clinical rotation. You will be watching your preceptor and shadowing them for several days or even several weeks, but at some point they're going to expect you to do it on your own. And if you are very nervous, that can be really tricky. So definitely get your nerves out of the way early on. Practice with a friend, family member, classmate. Just buddy up and practice some motivational interviewing. So you can actually go through a nutrition assessment and ask open-ended questions and just get really comfortable and familiar with that. One of the best strategies I have for the nutrition interview itself is always asking questions in the same order. So it doesn't matter what order you choose, but I would always recommend to ask questions in the same order. So for example, when's the last time you ate? What do you usually eat at home? What's your usual body weight? Have you lost any weight? How much time did it take you to lose that weight? Can I do a physical exam? Like that type of order, if you just always do it in the same exact order, you don't have to ask every single patient every question. For example, if your patient's NPO, you're not going to ask them what they had for breakfast. But if you always ask things in the same order, then you can skip a question without losing your spot. Just write that order down on a sticky note so that when you come into a patient room, you remember, I'm going to always ask these 7 questions more or less, and then you won't forget anything. I have a nutrition assessment sheet in my nutrition support skills course, which is really helpful for you to print out. And it gives you a really good cheat sheet about what to write, what to ask, when to ask it, what order to ask it in, and gives you kind of boxes to fill in so you don't miss any part of the nutrition interview. That's one of the biggest things I notice with interns at the very beginning as a preceptor. They forget questions. They get nervous. The interview starts to take a long time and they forget certain things. And so then you're doing your chart note and you realized, oh shoot, I forgot to ask the length of time in which they lost 50 pounds. And now I need to either go back up and ask them or try to write the note without that information. So you want to make sure you don't miss anything. And just practicing that, doing a couple dry runs can really help with that process. Nutrition-focused physical exam is another thing to review. So watch a video on YouTube, pull out your old notes, make sure that you can do a head-to-toe physical exam. Typically, preceptors don't expect you to do the micronutrient portion of that, but I would definitely review that because it is important to, if you have a patient who's at risk for essential fatty acid deficiency, you might be checking skin, hair, and nails, and you want to be familiar with doing that. But typically, I would just focus on muscle and fat wasting. Where do we appreciate muscle wasting and where do we appreciate fat wasting in the body, and then edema as well. And then also review diagnosis of protein, calorie malnutrition. If you are working with the pediatric population, know that the criteria are different. So for instance, with kids, we do the MUAC, which is the mid-upper arm circumference, and that's not something we typically do with adults. So definitely review that if you're going to work with peds in your rotation. A couple of general tips for clinical rotation success. My number one tip, which every intern should do without fail, is to take notes. I am always surprised when I have an intern who doesn't take notes, because if you think you're going to remember it, you probably are not going to remember it. The rotation is long, the days are long, there's a lot of information coming at you. You have to take notes. So my strategy and what I always recommend for interns is to take notes, have a piece of paper, a notepad, or a notebook handy at all times. So whenever your preceptor is telling you something, you can write it down. When you go into rounds, bed rounds or ICU rounds, you can be taking notes. Take notes of any term or medication that they mention that you don't know. And then at the end of the day, you can look all of those things up so that you, the next day, come in with more information. Also, your notes can be super helpful for studying for the dietitian exam as long as you organize them. So at the end of every week, it's good to sit down and kind of organize your notes. Myself and other people in my dietetic internship, we kept notebooks for every rotation, and we would essentially use the notebooks to study for the RD exam, which was a really effective tool. So we would take lots of notes, and then at the end of the week, I would transfer the notes into another notebook or a Google Doc, but I would organize them. So like, here's my oncology stuff, here's all my GI stuff, here's all my medication stuff. And then I was basically creating an awesome study guide for the RD exam as I went through my rotation. But it is important to take notes. It's also really important to organize them. So if you have 6 notebooks full of random notes, that's not going to be very helpful. You want to make sure that you're organizing those. So whether you prefer to do that written or if you want to do that digitally and create a Google Doc, that can be a really, really helpful study tool. It's also great to repeat things over and over. So for instance, if your preceptor tells you something once and you don't write it down, you're probably not going to remember it. If your preceptor tells it to you and you write it down, and then at the end of each week, you're transferring that note into a Google Doc and saying like, well, here's an oncology med. It causes dry mouth. And then you're using those notes again the third time to study for the RD exam. Now you've rehearsed that one bit of information at least 2 or 3 times. There's a really good chance you're going to remember it after you have that repetition. Definitely ask questions, but not too many. So in terms of a healthy amount or an appropriate amount of questions to ask, it really depends on the preceptor. You don't want to overwhelm them or make the day go on too long by asking too many questions. For example, if you're asking 10 questions an hour, that's probably too many for most preceptors. I would also really think about the questions that you ask. So the way that you ask a question can communicate different things. So for example, if you're just asking, what does that medication do? What does that medication do? What does that medication do? You're basically asking your preceptor to feed you information. A potentially better way to ask the question is, what are some of your favorite resources to learn about oncology medications? And then they can point you toward a resource. So this is subtle, but it's actually really important because preceptors really don't want to be feeding you information. That's not their job. You should be looking these things up. And so to ask, hey, I'm having a hard time keeping track of all these oncology medications. Do you have a good resource, a website or a book that I can look these things up on? That would be really important. So every preceptor is a little different, but try to ask more open-ended questions that convey to your preceptor that you're willing to put in the work and learn, rather than just asking them to do research for you or feed you answers. It can also be really powerful to ask your preceptor about their own life. So this can be a cool thing to do as you're walking to and from the unit, or as you're having lunch together. You can ask them what got you into clinical work, what's your favorite part of your job, how do you keep track of all this information. That kind of stuff can be really helpful as well. Do not rely on your phone too much. So I know this sounds really old school, but preceptors typically can't tell whether you're pulling up a PN calculation app and doing legitimate math on your phone or if you're texting. So if you do have a calculator or an app that you like to use, find a web-based equivalent and you can just pull it up on your computer. Most of the time, our interns are sitting kind of out in the open. It depends on what the office space looks like, but typically they're kind of sitting near the preceptors and your computer screen is visible. So it's a good opportunity to show that you're like really doing the work. If you're just on your phone, they actually can't tell what you're doing. So it can kind of be a turnoff and make it look like you're not paying attention when you're really just using a calculator. So I would really recommend actually getting a calculator, a physical calculator, so you don't have to use your phone because again, not only can the phone be a distraction, but it can be difficult for preceptors to know what you're doing on your phone, and that can be seen as really unprofessional. And then if there is some type of calculator or app or spreadsheet that you need, just pull it up on your computer so that your preceptor can see what you're working on. It's definitely okay to use your phone during breaks if you need to, but I would definitely use it sparingly. Always take a lunch break. This is non-negotiable. Taking a break is super important for rotation success. Even if your preceptor isn't taking a break, it's really, really important to take a break. It's legally required, and it's really important to give your brain a rest. So I'm a big fan of taking a walk, going outside, walking around the hospital, doing something active during your break if you can. I wouldn't be on your phone or do anything like that. I would just really give your brain a rest from information, because there's just a constant influx of information that's coming at you during your rotation. And if you're taking a break, you really, really want to give your brain a rest so that you're fresh and energized and ready to absorb more information when you come back from your break. I talk about this in the checklist, but I strongly, strongly recommend taking time off work during your clinical rotation. Now, I know a lot of interns work during their dietetic internship. I work during my internship at a restaurant several days a week and then on the weekends. But I would strongly consider, if you're able to take some time off during your clinical rotation, that would be really helpful, especially at the very beginning. Not everyone can take 6 to 12 weeks off of work, but if you can go down to maybe just a weekend shift or don't work during the week, just so that you have some time to gather all the information that you've learned every day, type it up into your Google Doc, organize your notes, all of those medications that you come home with every day. You need time to look all of that stuff up. And if you're just rushing to and from work, it can be really physically exhausting, and it's just hard to learn when you're constantly doing too much. So at minimum, I would take during the week off if you can, even just for the first chunk of the clinical rotation until you get settled in, because there is just so much information, and it's unlike any other rotation, and that the expectations of clinical are just really intense. So you're going to be working at least 8 to 9 hours, and then to go from your clinical rotation to work, and then maybe cutting into your sleep and then going back to the clinical rotation. It just can be really taxing. So if there's any rotation that you want to take time off during, it's the clinical one for sure. Coming up with a good routine is really critical. So again, clinical can be one of the most challenging rotations you encounter during your internship program. So establish a really good routine. I've given you some suggestions on the checklist, but I would really not underestimate what the clinical rotation, like the rigor and intensity of the clinical rotation. So it is a ton of information. Your preceptors will have high expectations of you in a way that probably your food service and community preceptors won't. Also, there's an intensity of the hospital environment. I mean, you see people suffering and you will see people dying. And so that can add to the burden and create a more mental burden and psychological burden on the student. So definitely want to take a lot of time to rest, establish a really good routine, and make sure that you have a good pattern that prioritizes sleep and gives yourself enough time to rest and recuperate. Definitely ask if you need help. So some preceptors are a lot more approachable than others, but we always want to ask. You can probably identify pretty early on a couple of the preceptors who are going to be really helpful to go to and ask questions. So one of the worst things you can do as an intern is to wait till the end of the rotation to ask for feedback. Don't wait until your preceptor has to give you feedback. So a lot of times there's a midpoint evaluation halfway through your rotation, and then there's an endpoint evaluation. And sometimes there's not even a midpoint, there's just an endpoint evaluation. If you're waiting until week 12 to get feedback, that's way too late. So early and often, at least during your third or fourth week, at the latest, I would ask your preceptor, what can I improve on? What are 3 things I can do better? Not all preceptors are great at giving you positive feedback. So if you hear mostly negative feedback, don't be concerned. It's hard. There's a huge learning curve, and we all expect that you're going to learn at different levels. So just be very prepared to hear some negative feedback. You can also ask for positive feedback. What am I doing well? If you know that's something that you really need. Hopefully preceptors are really good at giving both types of feedback, but sometimes we get busy, and it's a lot easier to focus on what you need to improve on than giving you positive feedback. So, and on the flip side, sometimes preceptors are giving you only positive feedback, and it can be really helpful to directly ask them, I really appreciate you saying that, but what's actually something I need to get better at? Because the whole point is for you to learn, and you can't learn if you don't know where your blind spots are. If you're really struggling, definitely reach out to your program director early and often. Don't wait for your preceptor to reach out to them and say the student is struggling. You really want to get ahead of that and work on some remediation. And you can always reach out to me as well. If you have specific questions, things that you're struggling with, I can point you towards some great resources. And then the last tip is a really fun one. I actually recommend watching a medical TV drama, some type of like fun, relaxing show. Grey's Anatomy, House, ER, St. Dennis Medical. Those are some of my favorites. I watched a lot of Grey's Anatomy before and during my clinical rotation, and it actually really helped in a couple of ways. I was really scared to go into the hospital. I had never been in a hospital before, and it really helped me like get acclimated with the hospital environment in this kind of like light and fun way. It also really helps with terminology. So they're talking like some of these medical TV dramas are more accurate than others, but generally they're talking the talk and using the lingo that you would use in the hospital. So it can be like a fun way to kind of understand the vibe of the hospital and get used to those hospital terms. They're also just highly entertaining. So that's kind of a fun one if you have some time before or during your rotation and are going to watch some type of TV show. That's like a fun way to decompress at the end of the day. So you definitely download my checklist, grab my nutrition support skills course, which is going to walk you through all of the information in this presentation, as well as many case studies, asset-based resources, lots of resources that you're going to use during your internship and even after. So my nutrition support skills course is an entry-level course, meaning it's appropriate for dietetic interns. Once you become credentialed, you can get 23.5 continuing education credits, which is 2.5 years worth of continuing ed, which is huge. And it can really jumpstart your career as a clinical dietitian. So you'll get all of these resources that you'll use, intermediate and advanced resources that you'll end up using as a clinical rotation in your future career.